Thank you.
Thank you. Thanks so much.
Cheers. Let's talk.
Let's start with your name.
I'm Catherine Zahn.
Your claim to fame.
I'm the president and CEO of the Center for Addiction and Mental Health.
And your motto?
My motto is always take the high road with grace.
It's a good one.
My first personal encounter with it was when my aunt had what in those days we referred to as a nervous breakdown. It was something a little bit mysterious, a little bit frightening, and I guess the sadness is that she was never the same.
My perception with mental health problems is that if you've never experienced it in your family, you have no reason to talk about it. And if you have experienced it in your family, you don't want to talk about it. So where should this conversation take place for the average person? Because that's who you want to reach, right?
If you're worried, if you're not sure that something is ordinary or within the realm of normal for you, then ask someone, ask a professional.
That's the scary part, isn't it, though?
To be able to have that conversation with yourself. That meaning it's really about communicating that message of hope. And also communicating the message that there's help.
What is the toll on society if we don't deal with this problem?
There are those who could put a dollar figure on it, and what I would prefer to say is that in the end, our society is judged by how we support, how we care for the most marginalized people in our society.
How do you gauge what is sad and what is depressed? I mean, it's with mental health, it's not a very tangible thing, and perhaps that's why it's so difficult to understand.
It's difficult because it's the thing that makes you human, right? Your brain, the way you act, the way you think, the way you talk, the way your emotional responses are. We don't know as much as we need to know about the brain and how different it looks when people have different thought processes. If we knew about those things, I think that would go a long way towards breaking down that barrier, and I definitely am aware of the amazing advances that have been made in our understanding of the brain, of the nervous system, just in the last decade or so. Only recently, when we started to allow ourselves to believe the adult brain can change, we have actual physical imaging evidence that the way the brain is structured can change.
You've received the largest donation
that's focused on research in mental health. It's a $30 million donation from the Campbell family, and when I start to talk about this, all kinds of thoughts and emotions come over me, and
because of the potential,
it almost changes everything, right? It has to turn heads. It has to make people say yes. Why haven't we looked more closely at supporting research into the brain functions and dysfunctions that result in mental illness? And my dream is that people are saying right now, why didn't we do that?
Yeah.